Good day, everyone. My name is Rafidah. I'll be presenting a paper titled Women and Exercise. Is it just a trend or a sign of health awareness? I will begin my presentation with background of study. Women's health has often been overlooked due to many factors, which restricts discussions and access on the treatment. Lassie, Wade, and Amiel 2025 note that conversations about women's health have mostly revolved around reproductive issues such as maternal health, contraception, and pregnancy care. In reality, women do face their own sets of health issues that must be addressed by the government and other relevant sectors. Women's health issues encompass a diverse range of concerns, including reproductive health conditions, mental health disorders, and chronic diseases, all of which necessitate targeted research and tailored interventions to improve health outcomes across various demographics. According to a 2022 survey, almost a billion women, or 1 in 3 respondents, reported experiencing significant physical pain the previous day. Moreover, 1 in 4 women, approximately 700 million, face health issues that hinder their ability to perform everyday activities. In Malaysia, Salapan 2022 mentioned obesity, diabetes mellitus, hypertension, menstrual problem, and pelvic pain to be among the most common health issues that affect women in this country. This study posits that a woman's poor health may stem from personal choices. Her lifestyle decisions, particularly regarding physical activity and the incorporation of exercise into her daily routine, can significantly impact her health. Research indicates that a sedentary lifestyle poses various health risks. It does not only disrupt metabolism, potentially leading to weight gain and increased fat accumulation, but also adversely affect cardiovascular health, triggers hormonal changes that may elevate the risk of certain cancers, and contributes to heightened inflammation in the body, which is a known factor in many chronic diseases. There are several past research on women's health and physical activity that this study have referred to. The first one is a study by Han in 2021, which stated women's health refers to a focus on health issues specific to women, including research, healthcare services, and education aimed at reducing health disparities and promoting wellness. Women's health is not limited to reproductive care, as it includes mental health, chronic disease, access to care, and social determinants. Women's health encompasses the general well-being of females throughout all stages of life, including both gender-specific medical conditions and the social, economic, and cultural factors that shape health outcomes, especially within specific national settings such as Malaysia. Research also shown that exercise has been consistently associated with reduced risk of cardiovascular disease, metabolic disorders, and obesity among women. A bibliometric review of research on exercise and women's health from the year 2010 to 2024 indicated that physical activity is a key intervention for improving health outcomes across the lifespan, including cardiovascular, metabolic, and immune function. Additionally, women who engage in regular physical activity demonstrates better weight management and improved lipid profiles with higher HDL cholesterol and lower LDL cholesterol. Beyond physiological benefits, physical activity significantly contributes to women's mental health. It is found that regular exercise positively influences body esteem and self-image, which are critical components of psychological well-being. Moreover, structured high-intensity exercise programs for inactive young women have been shown to increase physical fitness and psychological empowerment, reinforcing long-term participation. Aerobic exercise has also been demonstrated to reduce mild depression and anxiety, particularly in populations such as new mothers and young adults. Physical activity is widely recognized as a key factor of women's health across different life stages. This includes pregnancy, menopause, and post-menopause. Recent research increasingly highlights physical activities as an effective lifestyle intervention for improving physical health, psychological, and reproductive health outcomes among women. In addition to physical health, Mental health is an essential component of women's health, with increasing evidence indicating a rising prevalence of psychological distress among Malaysian women. Mental health has also emerged as a growing issue among Malaysian women. Studies report notable levels of depressive symptoms during pregnancy and the postpartum period, which can negatively affect maternal functioning and child development if left untreated. These findings underline the importance of integrating mental health screening into routine maternal health care services. The next review of literature is focusing on health awareness campaigns for women in Malaysia. Many initiatives have been introduced to improve women's health in Malaysia. The government has prioritized upgrading healthcare facilities and expanding access for women in both urban and rural areas to safeguard their right to a healthy life. While these efforts are essential, it is equally important to strengthen health awareness among women, as awareness is often the starting point for adopting healthier lifestyles. Several campaigns address chronic illnesses such as cancer and heart disease. One example is the Global Breast Cancer Awareness Campaign held every October, widely known as Pink October or Breast Cancer Awareness Month, which aims to educate the public about breast cancer, promote early screening, and provide support for those affected. Another is Go Red for Women, which seeks to improve women's knowledge on heart disease and stroke so they can take action to live longer and maintain better heart health. Other initiatives focus on promoting healthy lifestyles, particularly physical activity. Examples include My Body is Fit and Fabulous at Home, a community-based weight loss intervention targeting overweight and obese housewives in urban areas, and the women's AIDS organization #Girls4Goals campaign, which encourages participation in physical challenges and other sport-related activities. These campaigns also reflect strong collaboration between government and non-government actors, alongside corporate participation through corporate social responsibility programs. Companies involved often come from the health and fitness industry, including sports brands such as Asics, Nike, and Adidas. KPJ Healthcare Berhad, for instance, partnered with Watson and AirAsia through its Because She Matters campaign, launched in conjunction with Women's Day 2025 to encourage women to take control of their health. This study also reviewed articles and content that are related to the roles of social media and fitness influencers on women's physical activity. Currently, social media plays a major role in shaping public health awareness. In recent years, social media platforms such as Facebook, Instagram, Snapchat, and TikTok have become central to everyday life, shaping how people find, exchange, and absorb health-related information. With over 5 billion users worldwide, these platforms influence a wide range of health behaviors, including mental health, physical activity, diet, body image, and substance use. In addition to the health-related information that are widely accessible by social media users, there are also growing health trends that potentially have a strong influence on women's participation in exercise and physical activities. To the list, these platforms could shape what fitness looks like, what workouts are considered desirable, and how women measure progress. These trends can increase exercise involvement by making workouts easier to access and by building supportive communities, even though they can also discourage participation when they promote unrealistic bodies, unsafe training practices, or appearance-based motivation. One of the popular trends is the Great Lock-in that has taken off on TikTok and Instagram, inspiring people to focus on self-improvement from September 1 through December 31, 2025. The challenge centers on sticking to routines and developing habits, especially around fitness, to end the year on a strong note. For example, a TikTok user Mahima Panduria posted her lock-in plan, which includes walking 10,000 to 12,000 steps daily, strength training 3 to 4 times a week, doing Pilates twice a week, using the sauna twice a week, prioritizing protein-rich meals, and cutting back on sugar. In Malaysia, an Ogilvy Malaysia report found that millennials and Gen Z have redefined fitness, health, and well-being as a lifestyle shaped by community, culture, and self-expression, creating new opportunities for brands to build more meaningful connections. The report also highlights evolving cultural attitudes towards strength, recovery, and longevity. Female-first fitness is gaining momentum, with women defining strength on their own terms, while movements like #MuscleMummy celebrate strong, capable bodies. Recovery and sleep are being positioned as tools for better performance, and today's wellness mindset prioritizes vitality over anti-aging, emotional fitness for men, and healthier work-life integration for executives. In addition to the fitness trends growing on social media, influencers are just as important in boosting women's participation in exercise. According to Durrell et al. 2022, in times of a global decline in physical activity, it is crucial to identify effective ways to motivate people to be more active. Since they can reach large audiences, social media fitness influencers may serve as an important form of digital health communicator with the potential to shape health behaviors. By documenting their daily routines and results, they inspire followers to pursue healthier lifestyles. Their credibility shows how strongly they can affect the intention to be physically active. Next, I want to talk about the emergence of fashionable exercise outfits. Fashionable exercise outfits can encourage women to be more active by making movement feel accessible, comfortable, and socially acceptable in everyday life. When workout-inspired clothing is stylish as well as functional, it can boost confidence and reduce barriers like feeling not dressed for the gym, making it easier to go for a walk, attend a class, or fit activity into a busy day. In this way, athleisure supports physical activity by helping women feel prepared to move, whether they are exercising or simply choosing a more active routine. Rabinovich Fox 2024 mentioned that brands like Nike and Adidas have made their way into women's wardrobes, even though they may not be a dedicated gym goer or a sport fanatic, but knowing that these brands do not just sell comfortable, performance-boosting gear, they also offer pieces stylish enough to wear straight from a workout to a lunch meeting afterwards. One good example of sports that show how fashion has influenced people's participation in physical activities is pickleball. According to Cheong 2025, since taking off in Malaysia around 2019, pickleball's popularity has extended into the fashion world. Many brands are now rolling out pickleball-inspired collections that fuse everyday staples with sportwear. Beyond creating game team designs, companies are also collaborating with venue operators to host product launches and social events. Because Malaysia is a Muslim-majority country, the demand for modern sportswear that aligns with Islamic teachings has helped drive this trend. Today, many Muslim women feel more confident taking part in physical activities as these outfits offer comfort and freedom of movement without concern about exposing parts of their bodies. Among brands that are venturing in Muslimah sportwear markets are Kimara, Numa, Kalawar, as well as celebrity and influencer brands such as Neolofa, Kalakisha, and Chakanis. While offering modesty, these brands also promote stability and sense of fashion, which easily attract women to be active. Discussion and conclusion. A sedentary lifestyle and limited movement caused by busy routines can negatively affect women's health. Given the rising health risks faced today, women are encouraged to maintain an active lifestyle and engage in regular exercise. Research has documented many benefits of physical activity, including more effective weight management and improved metabolic health, which may support longevity, quality of life, and healthy aging. This article is limited by its reliance on secondary sources, drawing mainly on past studies and existing initiatives that encourage physical activity among women. Future research should consider primary data collection, such as survey or interviews, to better understand women's motivation for exercising. That's the end of my presentation. Assalamualaikum and thank you.